It starts like this. You're finally getting a handle on your baby's schedule. Sleep is improving, maybe even a few giggles light up your day. And then suddenly, teething hits. It feels like everything's flipped. Your happy baby is suddenly drooling like a faucet, gnawing on everything in sight, fussier than usual, and their sleep? Out the window. Welcome to the teething phase, one of the most universally dreaded yet completely natural parts of your baby's development. But here's the good news. You're not helpless. In fact, there are several simple science-backed ways to help soothe your baby through this sometimes turbulent milestone, using natural remedies and daily life adjustments that are both safe and effective. So today, we're diving into everything you need to know about how to handle baby teething. What signs to look for, what's happening inside their tiny mouths, and what you can actually do to help, with a strong focus on natural, gentle, and parent-approved methods. First, let's understand what teething really is. Babies typically start teething between 4 to 7 months of age, though some start earlier and some later. It's all perfectly normal. The first teeth to appear are usually the bottom central incisors, followed by the top ones. As the teeth push through the gums, it creates pressure, swelling, and inflammation, kind of like a mini eruption happening beneath the surface. That's what causes the discomfort and crankiness. Now, here's what teething doesn't cause: high fevers, diarrhea, or full-blown illness. If your baby has a fever above 100.4 degrees Fahrenheit or is vomiting, always call your pediatrician. While mild temperature spikes are common with teething due to inflammation and stress, anything higher is likely unrelated. So, now that we've got that science cleared up, let's jump into the good stuff. What can you do today to help your teething baby feel better, naturally and effectively? One of the simplest things is using pressure. Counterpressure helps soothe the ache by balancing out the pain from the erupting tooth. Clean your fingers thoroughly and gently rub your baby's gums with a clean finger or a moistened gauze pad. Most babies actually enjoy the massage and may even try to bite your finger. That's a good sign. Silicone teething rings are also amazing. Pop them in the refrigerator for extra cooling relief, but never freeze them, as frozen teethers can become too hard and hurt the baby's sensitive gums. Choose rings made from BPA-free silicone. Avoid liquid-filled teethers, which can leak or grow mold if punctured. Another powerful but often underrated tool: cold, soft foods. If your baby has started solids, you can offer chilled applesauce, yogurt, or a slice of cold cucumber, peeled and under close supervision. The cooling effect numbs the pain, while the act of gnawing provides that helpful pressure. Mesh baby feeders are fantastic for this. Just pop in a piece of cold fruit, like banana, strawberry, or watermelon, and let them suck and chew safely without risk of choking. And speaking of sucking, cold breast milk popsicles or frozen breast milk in a silicone feeder can be both comforting and soothing. Hydration is also key. Teething increases drooling, which can lead to slight dehydration, so make sure your baby is drinking plenty of breast milk, formula, or water for babies over 6 months. For nighttime relief, when teething pain tends to peak, you can try a warm bath before bed to calm their nervous system, followed by a gentle facial and gum massage. Swaddling or using a weighted sleep sack can help them feel secure during restless nights. Now, let's talk about some safe natural remedies. Chamomile is one of the most widely trusted herbs for baby teething. It's gentle, anti-inflammatory, and calming. You can soak a clean washcloth in cooled chamomile tea and let your baby chew on it, or offer a very diluted version in a bottle if your pediatrician approves. There are also chamomile-based teething tablets and gels, but make sure they're free from benzocaine, belladonna, or alcohol. Always read the label carefully and consult with your pediatrician before using any product. Clove oil is sometimes recommended because of its numbing properties, but it's too strong for direct use on babies' gums. So skip that, unless guided by a professional. Coconut oil, on the other hand, is a great natural soother. It has mild antimicrobial properties and can help reduce gum inflammation. You can rub a tiny dab on your clean finger and gently apply it to your baby's gums. Let's not forget amber teething necklaces. They're trendy, but also controversial. Many parents swear by them, believing that the amber releases succinic acid that helps with pain. However, pediatricians and safety experts strongly advise against using them due to the risk of choking and strangulation. If you still choose to use one, always supervise your baby closely and remove it during naps and bedtime.